Assalamualaikum and welcome to the Leaders Summit main stage right here at the Global Health Exhibition. My name is Renee Bourne and I am delighted to be here today leading the charge on our panel discussion this afternoon titled Rethinking Success in Healthcare, from Lifespan to Healthspan and Life Quality. Ladies and gentlemen, please join me in welcoming to the stage Her Royal Highness, Princess Dr. Haya bint Khalid bin Bandar Al Saud, Senior Vice President of Research at Hevolution Foundation, leading a mission to extend healthy human lifespan through cutting-edge science, accessibility, and global collaboration. Welcoming on stage, Tina Woods, founder and CEO of Business for Health, a visionary strategist redefining health as an economic asset, driving cross-sector innovation that aligns business success with population well-being. Welcome, Tina. Welcoming on stage, Dr. Todd Christian, Chief Scientific Officer at GeneType, who's helping accelerate the shift from reactive sick care to predictive preventative healthcare through genomics, multiomics, and personalized medicine. Welcome, Dr. Todd. Welcoming to the stage, Dr. Johana Carolina Vega Leonel, neuroengineer and scientific advisor at Chaanakya Capital as Neurotech Venture Fund investing in seed and pre-seed neurotechnology companies. She combines her research experience from Stanford neurosurgery with a venture advising to advance equitable neurotechnology and longevity innovation globally. Completing our lineup of panelists today is Elizabeth Angel, co-founder of Agora, a global health innovation and media company pioneering an integrated approach to body, mind, and heart, blending neuroscience, behavioral science, and gamified engagement to turn well-being into a measurable, inspiring pursuit. Welcome, panelists. Just reinforcing what Lucy opened with earlier, for most of modern history, healthcare success was measured through the years lived. But today we're asking a far more meaningful question. How do we ensure those years are healthy, productive, and dare we ask, joyful? Ladies and gentlemen, thank you so much for taking the time to join us here today. Let's start by setting the vision. What does success in healthcare really mean today? Your Royal Highness, Dr. Haya, Hevolution's mission is to extend healthy human lifespan, not just longevity, but quality of life. How do you define Healthspan?
First of all, I would like to thank you for inviting me to speak today, and I think this is the best platform to share our mission that requires joint forces to work with each other. So let me start off with what do we actually do? As Hevolution Foundation, we are a purely scientific foundation that does one main element, is to understand the biology of aging. And the reason why it's very important to understand the biology of aging is for us to intervene and extend healthy lifespan. The meaning of healthy lifespan is the number of years that we live in good health. It will require to understand the biology of aging. Now, the big question is it a reality today? Is the biology of aging is it defined? Is there data out there that proves the concept of healthspan? And the answer is yes. There are 11 hallmarks of aging that are extremely defined, that work in a very complex, holistic way, that requires latest tools and technologies to understand the system biology of how they actually work. So to answer your question, is Healthspan a reality? Yes. Can we extend the number of years in good health? Yes. How do we transfer this into reality? There are multiple very important elements that have to be in place that we as a foundation are enabling today. One is, how do we further understand aging biology? So we give grants to increase the knowledge of science of aging. Second, we also invest in interventions that can help us intervene biologically to extend healthy lifespan. Third is, how do we take this to the consumer? So everything that we work on and invest on, we try our best to take it to the patient. And this is why we are also here today to start conversations with policymakers, with clinicians, on how Evolution can support in that perspective. Now, what's very important for everyone to understand, it's not the number of years that we live or extending lifespan is what we want to achieve.
Absolutely.
What we want to achieve today is, how do we increase the number of years that we are in good health? And how do you define it today? Today, I think the average lifespan in Saudi is around 76 years of age. But if you look at how many years do people live in bad health, it's about 10 years. The average is 10 years. So people around 66 years of age, they start developing disease. And we're celebrating lifespan. Today, we need to understand why this observation is happening. Why is the average onset of age-related diseases in Saudis as young as 30 years of age? A lot of very important demographic, scientific information has to be collected. And there also has to be unification between scientists, investors, also clinicians, in order to address this topic. And this is what Evolution is extensively working on these days.
Absolutely. Thank you so much. Holding on to what you've just opened with there, I would like to ask Tina. Your work also reframes health as an asset, which it absolutely is. Something we can invest into, create thriving, productive societies. How do we turn this idea into measurable, commercial and policy-driven outcomes?
Thank you. First of all, it's a huge pleasure to be here. And yes, I think for too long we've been seeing health as a cost in many, many nations, many societies. And we've been very, very good over the last decades, actually, at increasing lifespan and health span through all the medical advances that we've seen. And actually, a lot of them have been public health advances. But actually, we have seen worrying signs over the last few years where we are seeing in some of the most wealthy and economically developed nations in the world how lifespan and health span are actually dropping. And the gains that we've seen are actually stalling or indeed declining and reversing. So this suggests a huge problem that we have to tackle as a world community, and building on with what has just been said by Dr. Haya, is we must look at how do we invest in health as an asset, and how do we actually reverse some of these worrying signs. It's actually becoming more and more of an economic problem, let alone the societal and health issues that result. We are seeing trillions being wiped off economies through ill health, and indeed with some of the work that I'm doing in the UK context, we're really looking at how do you actually link health with economic growth metrics, because the situation has reached the levels that it has done. So I think we have to look at, as we've mentioned, we have to look at really what does health span actually mean and how we can measure it. And so some of the work that I've been doing in the context of my work at the International Institute of Longevity, as well as with the Human Exposome Project, is really about how we can look at creating a prevention-based society and economy where more and more people can live in good health, and we can minimize the period of multimorbidities and chronic diseases that we are seeing as people are getting older, which is the real problem. So just a little bit of a word on what I mean by exposome. Some of you may have heard about the Human Genome Project. Now, this is a multi-international endeavor that spanned at least about 25 years. And it was all about decoding the human DNA. And actually what we found from that work was a lot of information, a lot of knowledge, but what came out really loud and clear was that genetics is actually a relatively small proportion of the determinants of our health. And actually it's how our genetics are impacted by the wider environments in which we live, work, and play. And what I mean by impacts, I'm talking everything from environmental threats and toxins in the environment. We're seeing microplastics, air pollution, for example, is very, very good in areas around that. But I think worryingly, and especially in the modern world that we live in, psychosocial anxieties, stress, emotional health, these are really, really dragging the health of citizens, and very worryingly also in the younger populations. The food that we eat and, of course, the exercise that we get are also huge, huge issues and are actually reflected in the exposome, which is the wider environments which impact our biology. And so these are sort of the areas that I think we really do need to look into in much more depth, and this is what the Human Exposome Project is all about. And in fact, the work that I'm doing at the International Institute of Longevity, and of course my colleague Joanna Bench was speaking earlier this afternoon about the work that we're doing with leading clinics around the world, is we're really trying to understand what this next frontier of longevity is all about. So it's really building on all the excellent work that we're doing to understand the biology of aging, but also to understand the external stresses like psychology, like our behavior, how we actually thrive as human beings in our environment. So this is a real next frontier that I think is very, very exciting and actually needs to be measured and factored into government decision-making, policy decision-making, and of course the big investments that are being made by sort of insurance, pension funds, etc., because these will have major impacts on our societies and in nations around the world, and really looking at really what is it that makes a life worth living and will inspire us and motivate us to be able to have the lives that we want to have as humans. So I'll stop there, but we can measure it now, and we can do something about it.
Thank you so much, Tina. And absolutely, we can come back and visit you and you can give us a little bit more. If we can revisit our second theme, from reactive to preventative, how can data and technology drive proactive health? Todd, our friend on the end. Genomics and multiomics are giving us the ability to predict disease long before symptoms appear. How can these insights accelerate and transform from the reactive sick care to proactive, preventative, and predictive healthcare and personalized medicine? Thank you, Todd.
Great question, thank you, and thanks for the opportunity to be here. I think for those of you who may not be aware, our mission at Illumina is to truly unlock the power of the genome. And Tina mentioned earlier the Human Genome Project, which was really just the beginning. And I think the way we like to think about the use of technology and data is continuous innovation of that technology, and ultimately the holistic consolidation of data across different scientific disciplines, across different modalities. It's really building beyond the molecular understanding, the molecular basis of understanding, and extending that much more and evolving that much more into a multi-dimensional view of health. And that is, I think it gets to the exposome and understanding all of the factors that are important to transition from reactive to proactive and preventative. And fundamentally, I think we can use the genomic technologies and techniques that exist today to extend the data sources. And in doing that, we can actually also have consistency in that data format so that we can use the data more effectively to draw more actionable insights from that data. And I think that's the key, is actionable insights to develop an early understanding of biological variation and the interactions of the biology as it relates to healthy living. And so I think it really starts with early understanding of understanding that variation, which in my view starts with screening. And we have that capability today that exists, that's the essential ingredient to move from reactive to proactive, is to understand early, test early, before symptoms appear, I think the Kingdom is initiating here a number of initiatives that are very important, from premarital screening to newborn screening, where the community and individuals and clinics can learn and understand risk factors so that individuals can change behavior. We can change environmental exposure and reduce environmental exposure that may have an impact in downstream clinical outcomes. In addition, extending into clinical diagnostics. So ideally, screening and testing pre-symptomatic so that we can determine more effective treatments for those individuals and ultimately allow for a better lifestyle and increased health. And then even further into population studies where we can better understand risk factors across various populations. And in areas I mentioned like cancer, cardiac disease, various inherited diseases, where it's very important to understand what those, what the potential variations may be, again, so that we can take action. So I think the most important factor is using technology and combining the right sets of data, the combination of data. And I think that's where we have the biggest opportunity, is to improve at how we combine different sources of data beyond just the biological data, but environmental data, clinical data, so that we can use that information to truly extend from reactive to proactive, preventive, ultimately predictive, and personalized care.
Aiming for predictive at the end, absolutely. If I can build on what you've said there, Todd and Elizabeth, you approach prevention from a behavioural and emotional perspective. How do we combine biological data with emotional and behavioural insights to create prevention that is truly personal and engaging?
Thank you, Renee. Before I answer the question, I would like to say what an honor it is to be here as a female founder representing my own company, Agora Innovation, at the biggest health conference in the world, and to be sharing the stage with a legend as Her Royal Highness Princess Dr. Haya and the incredible work that she's doing here. As you know, only 2% of VC funding goes to women-owned companies, even though they have a 35% better return on investment. And so to the over 1,000 investors here today, invest better. And to the question, my health journey really started as a personal one. I was an athlete, and I got to the nationals of Finland, the country where I live. And over a period of prolonged stress, I ended up nearly dead, and with severe physical, mental, and eventually mental health issues as well. And my big question became, we can send people to outer space, and we have so much technology and new innovation. Why is it that we cannot figure out what is happening in our own bodies and brains and have the tools to solve this health thing? And so this journey took me around the world with a team of doctors and scientists. We covered over 2,000 events, 3.8 million different technologies. And the good news is the innovation, the solutions do exist. The problem is that, like Einstein said, we cannot change the world's problems with the same thinking we used when we created them. And what we found was that industries are siloed. So if you go to a neurology conference, they know everything there is to know about the brain, but they know nothing about endocrinology. And obviously, we know that hormones affect the brain, and if you zoom out from health, you go to a quantum technology conference, and they don't interact with health, and health doesn't interact with music. And so we wanted to connect the dots with those things. And so to more clearly answer the question, I think that it's putting things together in a new way, as everyone is saying here, preventative, personalized, and also gamified. I have a 22-year-old, and there's enough gloom and doom in the world. Nobody needs more stress. It doesn't matter which doctors or scientists you ask, but they all agree 70 to 90% of illness comes from stress. And so the question I really started to ask and interviewed thousands of people for is, okay, if stress is making you ill, what is making you stressed? And people said, interestingly, just 3 things. if anyone can guess what they are. And the first one was health, of course. It's hard to be happy if you don't feel good. The next one was money. And the third one was relationships. If we go into any career, we will study many years to have that career, but it doesn't matter who you are, where you live, or what you do. We're all in relationship with somebody. You know, it could be a romantic relationship with your spouse, you know, children or boss or anything. And so how much time do we spend really developing the skill of being in relationship? So
I think we can all relate to those three categories, and none of them are ever in balance. There's always something to address. If I can move into our third theme, measuring what matters, how do we actually quantify quality in Healthspan? Dr. Johana, your work with neuromodulation and digital biomarkers is turning brain and body signals into measurable indicators of well-being. What breakthroughs are most reshaping how we measure the quality of aging today?
Renee, thank you for the question and thank you for the invitation. It is a privilege to be here. Thank you so much. Especially representing Chaanakya Capital, one of the neurotech investors, early stage investors. We do invest in pre-seed and seed neurotech, which is important for acquiring all the steps that you all brought up, right? When you ask me that question, there are many things that happen in neuro, and people are not aware of it. I will start from saying we're moving away from static images and palliative treatments to proactive and dynamic measurements. So now we have neuromodulation devices that we can actually continuously monitor the brain, which you can continuously monitor in your changes that are happening in your brain, but also biological changes. Something that is happening in the MRI, which is the imaging technology, in the MRI technology, is the ability to take images at a time point. We crunch many different parameters of MRI, and they give results similar to what DNA demyelation gave before. So for someone who is not familiar with DNA demyelation allows us to see what are the changes of your DNA at a point in time as you're aging, meaning it tells you that you're getting older, basically. Same thing we can do now with MRI. Now, this is still experimental, but we can actually see that biological changes of the brain. Hopefully, we can pair this data, and there is research happening with EEG technology, and now we are able to have your brain fingerprints. We call it brain fingerprint. This is your brain waves, natural brain waves, and we can determine what is your fingerprint, which we can eventually use for your simulation, right? So we see changes of your EEG or your electrical signals, which is primarily how the brain communicates. Those are some of the impactful changes that you can see taking place in the day of life as people, as well as the ability to track these signals with your biological samples, meaning your proteomics, your genomics. Then we can actually see what is happening and have a prediction model earlier of a disease or a treatment before actually, in the case of Alzheimer's or Parkinson, before actually the disease takes place. So I will stop there. I can continue for a long time.
I love the passion. Thank you so much. I'm going to follow up with Todd. You're working with genomic and bioinformatic data. I had to Google bioinformatic data, by the way. On a population scale, how can we integrate neuro, genomic, and lifestyle metrics into a holistic model?
Yeah, I think this is honestly, I think this is the key to truly unlocking the value of these different sources of data. And it's really about bringing it all together. I think it's also probably the most challenging, one of the most challenging aspects of, of biology, of research, of environmental factors, because all of these data are independently are very interesting, and you can go really deep. But if we think about how do we then figure out what the right individual pieces of data can be most informative if we bring them together? And I think that's the challenge that we have, is how best to bring the different sources of data in a variety of formats, right? Bringing that all together, I think, to me, it requires an unprecedented level of collaboration and partnership. And I think that collaboration and partnership is across industries. I think it's across disciplines. It's across regions and different areas and parts of the globe, which is wonderful to see in action here, because I think this is also an area where there's an incredible amount of work and advancements being done in computational power and data sciences. So I think the key is getting to a consistency and unification of data format, determining which are the right few pieces of data best to bring together to make those interpretations, and then which requires data infrastructure, right? It's a significant effort in developing the data infrastructure to enable that, advanced analytics and bioinformatics, as well as AI. And I think having consistency across data sets is what will enable and empower AI to actually become effective and be able to be useful to truly deliver what we call actionable insight. So it's information across those data sets that allows us to make a different decision, to do something different, to make a different choice. And I think that, to me, is truly fundamental. I think we're right on the cusp, right at the beginning of being able to bring that together. It's one thing to generate the data. We've been doing a lot of work in the past number of years to generate data. Now we really have to bring the technology together to harness that data to truly capture the actionable insights from that.
Absolutely, yes.
So thank you
Dr.
so
Haya.
much. I just have one comment that I want to elaborate on. What's so interesting, while you're speaking, a school of thought came to my mind is like, today we're speaking about data. Maybe 20 years back, we wanted to find new technologies that can produce that data. The beautiful thing today is now we know a lot about our biology, but how do we make sense of our biology? And this is the key. And you asked a very important question. You were like, biotechnology. So biotechnology is how do you analyze the data and develop it in a format that's readable. But I think the challenge today is not biotechnology as it is how do we converge different sciences together that can help us understand this data. And just a very simple example is what happened with the HAP map. The HAP map one of the biggest genomic projects ever developed. We were able to read our genome completely, but we ask our question, how were we able to do this? We were able to do this by converging different sciences together. It was mathematicians that helped us develop algorithms that can make sense of this data. Now, I think today the challenge is how do you actually choose the important data? And this is where AI comes in today. However, AI also has its own issues today, especially in regulations. How do you make sure that it's ethically used? But I think the whole globe is going to address these challenges soon. So I just wanted to add some of that perspective.
I wonder what we'll be talking about in 20 more years when we look back and 20 years ago was data. Tina, yes, would you like to add your perspective?
Yeah, I just wanted to build on exactly this point that Todd and Dr. Haya just made about the importance of multidisciplinary collaboration. Because absolutely, this is the essential part, because we have the technologies now. We've got AI, generative AI, we've got quantum, we've got systems biology, and we have to bring the disciplines together. So in the context, and this is precisely what the Human Exposome Project is all about, it's bringing environmental health, social sciences, biology of aging, it's bringing all these disciplines together. around a real mission of understanding what really drives human health span, resilience, and flourishing. So I think one of the things that I think has been really missing in the longevity debate and the health span debate has been this focus on actually really understanding what makes us human. So it's about our mental and emotional state, or even the neurosurgeon who spoke earlier today even talked about spirituality. I think these are the things that we really have to understand and harness an understanding of really what drives our behavior and our motivation. And really, and asking this central question, what is a life worth living?
Yes.
It's not about living longer, it's about really addressing that question. So one of the things that I found really interesting, I was at a longevity investors conference quite recently in Gstaad in Switzerland, traditionally very focused on biotech, but actually for the first time, it introduced this concept of joy span as an investable and commercial opportunity. And what it signals, and what I found really interesting, it appreciates that actually there is going to be, let alone the societal impact and the quality of life, because we asked the question in this session, what is the quality aspect in all of this? This is absolutely what we must be addressing as a collaboration for the world, is really tackling into that. So joy span, what is that? It's about, because we know that, and we have the science now to show this, that joy and human connection are as protective or even more protective on our health than even things like exercise. We know that loneliness is a bigger killer than smoking. We know we have a crisis in our younger populations, but also across the generations, of social isolation and loneliness. In an increasingly connected world, we have this problem, is because we need to bring people back in our real worlds. We need to bring them back where family, love, all these sorts of things are fundamental values that are driving our science, our investment, everything that we are doing as a global community. We have to focus on that. And of course, it is completely interconnected with the planetary system. Health and the planet go together, the exposome. It's about we are part of a system, and we have to respect and nurture that. So I think it's a much bigger question about really understanding what is the world that we want to live in, what is the life worth living, and focus the science and the policy and the investment around that. Anyway.
Thank you for that extremely human response. I think everyone in this room has the value of their life, has children, can really understand why joy span is an extremely valuable idea. Dr. Johana, if you would like to add your point of view, and then we are out of minutes, I'm going to ask Elizabeth to do a very impactful close for me. So over to you, Dr. Johana.
Thank you so much. I just want to add a short point. So AI, as Dr. Haya actually mentioned, it has been a tool for neuroengineering. And for everybody here, as you mentioned, now many of the markers like sadness, depression, right, we can actually see it in the images. And using AI to crunch some of this data is becoming real. So now you're not saying, oh, I'm depressed and it's an imagination. Now we actually see the changes in the MRI. We see the changes in the EEG. We see the changes in the biomarkers. Now, what is amazing about neurotechnology and AI and quantum computers actually bringing alive is the capability of us crunching data and putting all this data and all these biomarkers and electrical signals and imaging together so we can make a sense of what is happening and how it's actually affecting our life and changing our day-to-day. And to your point, Tina, yes, it's not just extending life, but good quality, joyful life. Our joyful life is most of the time when we are healthy and functional and we can do the things that we want. So neurotech is a big part of this. Without neuro, right, we are incapable of putting all the dots together. Many of the signals come from the neurological signal, which actually transform into chemical signals and express into our behavior. So everything that you guys just mentioned is part of neurotechnology.
We need to close down that decade of unwellness at the end. We need to bring it smaller and smaller and smaller. So the health span is just the maximum. and then a tiny little bit of see you later. Elizabeth, if you could close us down for today.
Sure. 4 in 5 of the employees here in the workforce in Saudi Arabia are suffering from stress, anxiety, and near burnout. 92 billion SAR, that's 3% of the GDP, vanishes into sick care and illness. And I've had the privilege of living in Finland, a country that has been voted happiest nation 8 years in a row. I say that not at all to boast, but to build. Today, I would like to invite Saudi Arabia to be the first country in the world to lead its citizens by offering them preventative, personalized healthcare so that together we can build the future of good, happy Healthspan, because the future, the purpose of life is to enjoy it. So let's do that together. Thank you, shukran.
Ladies and gentlemen, a huge round of applause for our panelists. Wow, that is an expert panel. Unfortunately, we are out of time. We could go and go. You have been a fabulous audience. Thank you so much. Thank you.
Thank you.